Hi, I'm Dr. S.S. Honnani, surgical gastroenterologist. Today I'm going to speak about tuberculosis. Tuberculosis is very common in India and around 30 to 40% of Indian population is infected with tuberculosis, but they don't have actual TB. But once these bacteria become activated, then only it will cause disease. So it is so prevalent. So tuberculosis can affect from brain to bone, anywhere in the body it can affect. Most common presentation is actually patient will present with pulmonary tuberculosis. These patients will be having cough, sputum. These actually are high risk patients because these patients will spread the disease to other people. Other kind of presentation is like tubercular meningitis, spinal tuberculosis, or even abdominal tuberculosis. As a surgeon, I am seeing a lot of abdominal tuberculosis, especially in South Indian belts. Abdominal tuberculosis usually happens consuming raw milk or patients who are interacting a lot with the pet animals who are infected with tuberculosis. Even tuberculosis will come to veterinary animals like sheep, goat, dog, even cow, buffaloes. These animals also can get tuberculosis. So patients who have interaction with these kind of animals are also high risk of developing non-pulmonary tuberculosis, especially abdominal tuberculosis. Usually patients who present with abdominal tuberculosis will have vague abdominal pain, abdominal distension, or sometimes they present with intestinal obstruction. So whenever we have a patient, when we suspect tuberculosis, we usually get a CT scan done. CT scan will tell features of like multiple nodules or mental caking or ascites, or may show features of intestinal obstruction. This patient will subject them to diagnostic laparoscopy, and we do mental biopsy, peritoneal biopsy, ascitic fluid tap, and we'll do varieties of therapy. Sometimes like my habit is every time I do, I'll send also TB culture, because we don't know now currently lot of tuberculosis with resistant to regular drugs are high. Once we take the biopsy, if we don't send for a test, assistant test takes long time to do, so we may lose out the time. We may have to do one more procedure. So avoid these things. Whenever we suspect tuberculosis is very severe, better to send initially only culture and resistant panel. Like once we diagnose the tuberculosis, what we do? See, sometimes patient with abdominal tuberculosis will have specific condition called ileocecal tuberculosis. This patient will present with recurrent abdominal pain. When we do a CT, they show that there is a lesion in the cecum, mere appendicular area, cecum and small intestine. These patients, we subject them to endoscopy and we do a biopsy. Usually surgery is the last resort in tuberculosis treatment. First line of treatment for tuberculosis is medication. You have first line of medication, second line of medications. Treatment of tuberculosis is a long term, because usually pulmonary tuberculosis they give for 6 months. For abdominal tuberculosis we give around 8 months to 1 year. The problem I face with the patient is in the compliance. They take 1 month, 2 months, then they stop taking the medications. This should not be done, because if once patient develop resistant to regular drugs, then it's very difficult to treat, and cost of treatment also becomes very high. These drugs are very costly, and per month treatment cost may come around 4 to 5,000. Along with this, these patients should have also, in a part of treatment, have good nutritious food. So they should consume more non-vegetarian food or more nutritious food. That also adds up to the cost. So because of this, I think in India a lot of patients will stop treatment in between. But in India we have something called DOT center. In the government only provides TB medication free of cost, and they actually make sure that you take the treatment. Patient is very low socioeconomic state, he may be driving BMW or Benz. Everyone I am referring to DOT center, because DOT center government, whatever the medication providing for the tuberculosis is very good. They make sure that you take the treatment, they make sure that you are following the treatment, and they have immediate second line, third line management are all. It is actually properly planned. And DOT centers in India, especially I am working in Mangalore area, I'm amazed with their dedication, because they are very much dedicated in providing supportive and medical treatment to my TB patients. So like surgery we offer only suppose a patient has got an intestinal obstruction, or ileocecal tuberculosis is very much narrowed and patient is having obstruction. Only in these cases we do the surgery. Otherwise 95% of the patients will get cured with just medications. Only thing they need to is they need to get a treatment properly. And second problem I face in the patient is follow-up, because whenever we give the treatment, some patients may develop jaundice. In that cases we have to alter the drug, we have to manage the drug. So whenever the TB patient is there, even though they are taking DOTS therapy or anything, they should consult your primary surgeon, primary consultant regularly, because any untoward complications of medications will be addressed immediately. Don't get scared now. It is not like 30 years back, 40 years back, TB was a death sentence. Now it is not like that. TB has got a cure, and most important thing in a TB treatment is nutrition. So patient should eat good nutritious food which have high protein, high calorie diet should be taken, so that they recover faster. So TB has cure. Only thing is, one patient should stick to the treatment, follow the doctor's advice properly.